If you're preparing for a biomedical scientist interview, you're definitely going to find at least one scenario-based question among your interview questions. It's very important you answer this question very well because it's as important as your scientific-based question. Today, I'm going to be giving a sample answer on how to answer the famous question, tell me how you've worked under pressure, or give a scenario of a time where you've worked under pressure. You can use my answer as a guide and this video as tips on how to structure your answer for when you get asked this kind of question in a biomedical scientist interview. Tell us how you've worked under pressure or give a scenario of a time where you've worked under pressure. It's such an important question because the laboratory is a fast-paced environment and there's times or days where something different can happen that could lead to a high rise in workload, and it's important that you're able to manage this workload and also maintain patient safety and ensure that quality is being preserved in the laboratory. So that's why this is a very common question you're probably going to find when you get to an interview. One important tip when you're answering a scenario-based question is when you want to structure your answer, it's important to use the STAR method. The STAR is an acronym for situation, task, action, and responsibility. So the situation is you paint a scenario of what has happened. Your task, you talk about your responsibility regarding the situation that happened. Action, you're going to talk about what things you did, what actions you made to attend to the situation, and then finally you're going to be talking about the results. So that's like what your action did and how you were able to manage the situation. This is how you structure a very good scenario-based question. Another mistake that you should be avoiding is giving just a general terms. This is a mistake I also personally made during my early stages in interviews. I would just randomly say, oh, in a lab, you can have a very busy day and what I do every day is me working under pressure. No, you need to give a very specific example, a specific situation, a very specific answer to be able to score like as much marks as you can possibly score. I'm going to be giving a typical or a practical example on how I would answer this question if I was to be on an interview. So let's go. Interviewer says, tell me a situation where you've worked under pressure. Here is my practical answer. As a biomedical scientist, I came to the lab on a specific day and we got a call in the lab saying that one of our colleagues was going to be off sick. This meant that we had the normal number of workload, but we had reduced staff. So this increased the work pressure. After we had the call regarding the sick leave, there was a mini huddle between the biomedical scientist and the senior to re-strategize and to replan and to reshare the task for the day to be able to cover the sick leave, so that the tasks are evenly distributed among everyone and there is no tasks that was forgotten to be done for the day. I ensured that the analyzer was also ready for use, that the daily maintenance was done, QC was done, calibration was done, and reagents were topped up so that once a sample comes into the lab, it runs immediately without wasting any time. This ensured that we're able to keep the turnaround time of results processing in check, even though we had a less staff compared to the number of workload. As a biomedical scientist, I also communicated with the med lab assistants and APs so that they are aware of the situation of the day, that we're short of staff. The analyzer that was also dedicated for urgent sample was ensured to be given priority. So we have the urgent samples, once they come into the lab, they are able to be done. We also ensure that we prioritize samples from A&E, from ICU, from the pediatric wards and inpatients over regular GP samples because these samples have a shorter turnaround time and the patients are in a more critical condition, so we ensure to put priority over the more urgent samples first. On the validation bench, I also ensured that I had an eye out for any sample that needed troubleshooting. I ensured that I was also fast-paced with my communication skills with the ward if there was any sample that needed to be recollected, rerun, or any sample that was on the phoning limit that needed to be reported to the clinicals team. We also ensured that we dedicated an analyzer for urgent samples and ensured that that analyzer was always good and there was no problem, there was no downtime with the analyzers. Being that it was a coagulation and hematology laboratory, after putting priority to those urgent A&E samples, we also put priority on coagulation samples because coagulation samples are more time specific because they are a bit more critical. Coagulation deals with bleeding, and then when there was any sample that had a very high prolonged APTT or PT, which could lead to bleeding and lead to death, we ensured that we handled those samples first and then placed a call to the clinical team if there was any sample that needed to be reported. Even though this was a situation where the workload was very high compared to the number of staff, I ensured that I maintained quality. I ensured that I followed the SOP and followed everything that I've learned on regarding my training and competency. This ensures that our job was precise and accurate and could lead to proper and adequate diagnosis of the patient. Also, I ensured that even though this was a high pressure environment, I ensured to make myself calm under this high pressure. When I had to take a 15 minutes tea break, I collaborated with my colleague and we shared our breaks in time. Both parties did not go for break at the same time. We shared our break time to be able to have a rest and then come back a bit more refreshed. I also ensured that I documented every error that probably could have happened. If there was any error or incident, I ensured that I documented in the error log or incident log and reported to the senior management. By putting all this in place, I was able to ensure that we were in time with our turnaround time. Patients were able to receive their samples on time and there was adequate communication with the clinical team. Also, we were able to ensure that quality control and quality assessment was ensured throughout all our processes. And eventually, our manager was able to bring a cover for the shift, and the workload kind of stabilized, and we're able to go back to a normal working condition. But before that, I ensured to properly hand over to the cover staff who came to help with the shift. So we're able to properly hand over and the workload was able to normalize. The lab was able to function well. So yeah, that's a practical answer that I would give if I had an interview, and I'll tell you reasons why I believe that this answer works. Firstly, we created the scenario. The scenario was that somebody called in sick and we had less staff to a normal workload. That's a high pressure environment. Secondly, we talked about communication, how we communicated with other member of staff, how we communicated with the management team so that they could provide cover if it was needed. And now we also communicated with our senior staff who was able to give us each new duties to do, because if someone is off sick, they were assigned for a particular role for that day. So if they're off sick, we had to re-strategize and know how we're going to cover off that person's sick leave. We also talked about maintaining the analyzers, ensuring that QC is done, calibration is done. So this is the quality aspect of this question because it focuses on ensuring that even though we are short of staff, every sample that we're releasing results, we are ensuring that it's accurate. So we talked about QC, we talked about maintenance, we talked about reagents, we talked about calibration. This is the quality side of things. Now, a very important part of this question that we talked about was being able to prioritize work according to their urgency, because if you have 10 samples coming and you have 1 or 2 from A&E or from the ward and the rest are from GPs, you know well to attend to the ones that are from the ward first. So we talked about that in our answer, that we're going to focus first on the samples from the A&E, from the ward, before we attend to GP samples. So that's a very good way, because you might not be able to attend to everything, but you're showing them that you know the ones that have more priority that you should attend to first. We also talked about breaks, because to be honest, when you work, you need, a certain amount of, few minutes to rest and to regain yourself. So we talked about taking breaks and arranging breaks with our colleague. Our answer also talked about following SOPs and training and competencies. This also ensures that whatever we're doing in the lab, we're ensuring precision and accuracy. Our answer also talked about teamwork, where we had to collaborate with each other and share new responsibilities, teamwork in terms of break time, when to go on break and when not to go on break. And our answer also talked about reporting any incident or any error that could have occurred. We also talked about handing over when the shift was over, or when someone else came in to when someone else came in to cover the shift. So these are very important parts and aspects of working under pressure. And I believe that this answer works. Obviously, it might not be the 100% best answer, but I think it's a very good answer that can give you so many points. You can also make researches on what else you can add, but the purpose of this video was to give you a kind of insight as to what to expect, what they are looking for you to say when you get asked with this kind of question. That brings us to the end of today's video. I hope you learned a thing or two from this video. Feel free to ask questions in the comments, or talk about interview questions that you probably would like us to talk about on here, and we'll probably make a video for it. Thank you guys so much for watching, and I'll see you in my next video. Bye.